Hello viewers, today we have a patient with heel pain. We will see what is the problem that he is facing, how it happened, and what are the other difficulties that he is facing. Then we will see how it is being treated. Obviously we have to assess before that, and then the progression in terms of exercises we will be talking about and discussing. And so be with us, and if you have any comments, certainly comment in the comment box, you write it down. Do like, subscribe, and share the video with your loved ones or whoever has heel pain or any sort of musculoskeletal orthopedic problems or pain that he or she is facing. So again, do subscribe to the channel to help us give you more good videos about pain and what you need to do to fight pain, so that you can have a great quality of living and ultimately you can enjoy life to the fullest. So without further ado, be with us, stay with us, and let's ask this patient for today what he's facing with. So today you came with some issues, so could you explain what you actually have?
Well, I've got some severe pain in my left heel. On a scale of probably 1 to 10, it'd be about 7 to 8.
So around 7 to 8 on 10 you have pain. So how long have you been suffering this pain?
This has been on for the last 2 to 2.5 years.
2 to 2.5 years. And where exactly is the pain? So if you can show us.
Well, it's the left heel.
Okay.
It's around this area and
so right
and
about
the middle.
this area.
This area and
Like
and
a
little bit in the
horseshoe?
middle. Yes.
Okay,
Correct.
and then right over this point.
That's correct. A little to the right.
A little to the right. All right. So essentially, you have it in the rim of the heel as well as the central part
That is
of
correct.
the heel from the posterior aspect. All right. And then you said it's really painful because it's 7 or 8 out of 10. So that's really painful. So when do you think you have maximum pain, and when you think you have minimum pain?
Well, it's most severe when I wake up in the mornings. First thing, get up from bed and put your feet on the ground.
Correct.
That is when it hurts the most. So it feels quite sore at that point in time, and it's quite painful. I think the first probably 20-25 steps, and then after that, then the pain eases a little bit.
Right. So essentially, what you're saying is, if I may add on to what you just said, is long term when you are doing nothing or static, not in a dynamic phase, may it be laying down, may it be relaxing, is it also possible that after long term working or sitting in a place you have similar issues?
Well, there are at times, but it's mostly after waking up from sleep that it happens.
Okay, so mostly in the morning, after you get up, you place your foot on the floor, you have pain which is around 7 or 8 out of 10, and first 20 to 25 steps is really painful. That's where you have max problem, and this has been happening for the past 2.5 years. All right, so this is what we kind of learned about what this patient for presenting with. We will certainly test in terms of where actually he's been having pain. It could be bony origin, it could be muscular origin. I doubt it has any neural or any vascular connection, but let's obviously be going to test it and feel that everything is all right and what is the diagnostic issue, or we have to have a provisional diagnosis in terms of what kind of origin or causation of that pain is, and then we'll go from there. Just so that we are all on the same page, viewers, this individual has left heel pain for the past 2.5 years. Do you want to add on anything that I might have missed?
No, I don't think so.
Okay, all right. Thank you so much. Be with us. Stay with us. All right, we will ask the patient to walk on his heel and check if he has any pain while walking on his heel or not. So could you start walking on your heel up to this mark, go back and then turn and let us know if you have any pain. All right, you can turn. You can turn. All right. So now we will be testing a little bit for the ankle joint and a little bit around the knee joint, just to eliminate any red flags like pain or any kind of movement restrictions, and then we'll be jumping towards the heel. First, we will check the good side, which is his right side, and then we'll jump on to the left side. All right. So, could you actually extend your leg, like keep your knee straight and hold it right there? Any pain over here? Nothing. You're good. All right. Now pull your heel down. Any pain? Anything?
No, there is
Nothing.
no discomfort.
No discomfort. All right. Thank you. So pull your heel up or toes up, and let me resist it. Don't move. Any problem along the knee?
No.
So how about now? Do a little bit of extension, and then I want to push it up. Any problem? Anything?
No.
So no pain, no movement restriction. Everything, range is good, muscle strength is good, and obviously he does not feel any pain. And if I palpate over here, he seems to be no inflammatory response, and obviously you don't have any pain over here also. All right, around the ankle joint, right where I'm kind of placing?
No.
Not really.
Not really.
So I already checked his dorsalis pedis pulse right over here, and it looked similar to both left and right foot. So his vascular system is all okay. He does not have any sensory deficit, because I checked like with picking and pin pricks, and then also he did not give any kind of pain radiating, so he does not have any neural component involved. Now we are coming back to the the left one, where he has trouble around the left heel. So let's see if where and how the problem is kind of causing. So now extend your knee, hold it right there, let me push it down. It's all good, so no pain around here. Okay, now pull one sec, a little bit. Now pull your heel back down. Pull. Fantastic. So no pain again,
No,
right?
there's
So
none.
perfect. No discomfort, nothing at all. So now, when I'm doing this, so on the top, that's basically it. It's able to move. So there is a little bit of dorsiflexion or movement with where the toes goes up. That movement is a little bit restricted compared to the right foot. See how much it's moving and how much this guy is moving. So there could be a problem in the calf muscle tightness, which might be a problem area for the heel pain, because a lot of patients with heel pain actually presents problem in the calves. So we need to be aware of that. And he did mention that he has very low grade pain, about 2 or 3, when he was walking on his heel. So it might be a causation, the heel pain might be a causation from the calves, to a tight calves actually. Pull it down, pull your foot down. No pain, obviously, right? Nothing at all.
None.
All right, fantastic. So he does not have any problem when he's pushing his foot down. That means he does not have much of plantar fascia tightness, right? So because when he's pushing down, he has complete range of plantar flexion. He has no pain whatsoever around the heel region. All right. So now next, what we will be testing is that particular area on the left heel, and check where it's coming out from, either bone or soft tissue. Just so that you are aware of, you said that there was something that you want to add, which you forgot last time, which was around playing or something,
Yes.
right? Could you say that?
So when I play sport, when I'm on the move, running and playing some racket sport.
So like for example,
there's a lot of
for example,
pressure
which
on the
type of
knees.
sport?
Tennis or squash.
Tennis or squash, when you play, then you have
After
accentuate
after
of the
yes
heel. Okay.
after that, then there is, for at least the next half an hour to 1 hour, there is pain.
All right. That's a great addition that our patient said, that after playing any dynamic activity sports, especially racquetball or squash or tennis, he has a pain, and that actually persists for about 30 minutes to hour, maybe hour
Maybe
and
longer,
a half,
maybe
depending
longer.
on the day, depending on how much extent you are able to kind of run
Precisely,
around.
yes.
Correct. And the pain again would be around 7-8ish, as you said earlier.
Exactly.
7-8ish. All right. So let's see where exact. So what my thought process is, like a provisional diagnosis, probably it's stemming from a tight calf, because we are all amateur sports, especially we are not professionals, so we don't warm up at that high level. So it could be a cause. It's just a provisional diagnosis, but a complete diagnosis. So let's stick with us, and we will see if he has any issues with the heel or not, and then we will treat it out. All right, be with us, and don't forget to subscribe. Thanks. All right, so let's get started with testing the left heel. So our patient is lying on his belly, and now we will be trying and figuring out what the problem is around the calcaneum or the heel pain. So let me press and localize the area where he has pain. So could you tell me if you have pain in which area? Tell me yes or a no.
Yes, there is pain.
Okay, so you do have pain in here. Okay, and do you have pain around here also?
Mild.
Mild pain over here. So your max pain is right here at the center?
That is correct.
And then over here you have pain like around the rim. So what the patient said that the pain is right around the margin of the heel and then at the center. So the center point is not right below the calcaneum or heel, rather than it's at the margin of where the tendo Achilles meets with the plantar fascia and the calcaneal muscles. So right over here. So this makes us more believing that it is probably being caused by the calf muscles and not by the plantar fascia itself. If there is plantar fascia pain, then obviously the pain would be more over here and probably over starting from the here. If it's a heel spur, then right at the center of the heel mostly. But our patient today is saying the heel pain is right here at the margin. So it is highly likely that this is being caused by the pull of the calf muscles. So next we know right now kind of diagnose that okay, it's probably a soft tissue issue and not a bone issue, and then let's treat this soft tissue issue with some kind of chiropractic treatments, and after that we will see how the patient feels with the pain. All right, stick with us. Thank you. All right, so we will start with a little bit of relaxation around the calf muscles and also in the calcaneus, and then we will start with our basic procedures of chiropractic treatment. So just have a look that we are actually trying to release through percussion hammer gun the medial and the lateral calves. Because then it feels that it is tight, and in normal cases also it generally is a little bit tight because we walk and we sit down so much that it becomes tight actually. So one sec, let me cross this out. All right, I think we are good. We will just do a little bit of calcaneal relaxation, plantar fascia relaxation too. Patient really feels good with the percussion hammer gun because it really thrusts through the plantar fascia and the muscles, thereby increasing elasticity, improving flexibility, and for sure increasing the little bit of blood supply, blood volume in the localized tissue area. Perfect. Let's go with a little bit of chiropractic treatment right now. So could you again turn to on your back, please? All right. Lay on the bed. Perfect. Relax. Let's open up the knee joint a little bit. There you go. All right, perfect. A little bit of talar shear. Done. Nice. And then a little bit of calcaneo tib fib grind. Done. All right. So again, could you turn on your belly, please? So could you slide down a little bit? We will do a scraping or instrument assisted soft tissue mobilization, which will help try to clear the adhesions on the tendo Achilles or the Achilles tendon, we all know. We have already applied a little bit of moisturizer previously, just so that you know, just to reduce the friction. Okay, we will then do a little bit of similar technique for the calf muscle. Wonderful. I can see a little bit of redness coming in, which gives me an idea that the blood supply is increasing in that localized area. All right, we will then next actually do a little bit of laser to clean that area. Let me know if it's a little bit too hot or pinprick or anything of that sort. Please do remember that we cannot show you the entire treatment procedure. We are cutting in between just for the sake of, because none of you or I have the time to show the entire process. So don't think that the treatment protocol for each one is so short. It takes its own time. But for the purposes of this video, we are making it a little bit short, but showing you what we usually do for any individual coming with heel pain. All right, perfect. So this is actually our treatment protocol. For today, we will then test if this individual has any pain by doing the similar techniques that we have tested before and see what he has to say. All right, stick for the last segment with us. Thank you so much. All right, we will ask our patient that where he had initial pain on the left heel, if he has any pain right now or not after treatment. So could you tell me if you have any pain on the rim first?
No, I don't feel any pain at the moment.
At the moment, you don't feel any pain. Okay. How about over here, where you had max pain?
No, I wouldn't call that pain.
Okay. So by pressing right now, you don't have or you don't feel any pain as of now.
No.
Okay. So do you mind walking on your heel and then letting us know if you have any pain? All right. So our final test for the day, we will ask our patient to do our heel walking and check if he feels any pain. Just so that you remember, if it was around 7 or 8 out of 10 pain. So let's see how much pain the patient currently has. So could you kindly walk on your heels, please? Okay. And you can come back up to here, and then you can turn. All right. So how much pain would you say right now you have, if you have any?
I would say it's around 3.
Three.
Around
So
3.
okay, so it's around three. So it has, obviously it has not gone down to zero, and I don't expect anyone's pain to come down to zero in the first session. So, but his pain has significantly reduced from 7 or 8 to like about 3. So obviously he will be getting exercise protocol and posture corrective exercises. He has to continue that to, and then again come for the next session to continue for a better healing process. So thank you so much for being with us and watching how our patient heel pain is being treated. If you or anyone you know that is suffering from heel pain, please do not forget to let them know that we are here to take care of your pain and alleviate your pain as soon as possible, give you your confidence, give you your quality of life back in no time, so that you can live your life and enjoy it to the fullest. Again, please don't forget to subscribe, comment, like, and share the video. That would help us construct more good videos for you. If you like to specifically ask for any specific videos for any pathological conditions, do let us know in the comment sections, and we will be happy to take care of that video too. All right, have a good rest of the day. Thank you. Bye.